Welcome to Well Life. This is my practice. I thought I would give you a tour, and that would sort of be able to have the big picture. You can see what I do. So this is the entrance when you come in. So when patients come in, they're greeted at the front desk. This is Heather. She's also a medical assistant here. And so today she's on the front desk. Patients will come this way. They will check in. Then they'll be seated this way. So you can see that this waiting area is very well lit. You probably can't hear it, but there's some music playing, lots of nice natural light. And how it works is all the providers, including myself, have our own exam room, or exam rooms assigned to us for the day. I have my own exam room that's always my exam room. I don't alter because it's a big space, which I'll show you shortly. So patients enter, they never have to go into the clinical side. They're told where their provider is, so they'll say, Dr. Hart's in room 3 today. Patients will come over to room 3, they'll have a seat, and then the medical assistant will come in from the clinical side and bring them into their room where they'll be seen, and then they'll come out this way. Come with me, I'll show you a little bit more. I'm going to introduce you to the practice manager here, and what she does for me and for the students is we have to get them onboarded before they get here, and access to the electronic medical record and so forth. So this is Robin. Hi, Robin.
Hello, Dr. Golden.
So Robin's here. She's always available to help us and acclimate and help the students.
Welcome to Well Life.
This direction we have a lab for our patients. So when patients need their blood drawn, we'll bring them in here, have their labs done right here, and we get the results either by the end of the day or within 24 hours. We also have a lot of holistic care, and this is one of the holistic rooms. So we do have someone who does massage, and this is the massage room. So when you can have massage here, we also have acupuncture, Reiki, and so forth. And come with me, Glenn. One of my students is my cameraman at the time. They did build me, I have a pharmacy office. I don't use it. We're always within the clinical space. So I said, repurpose this. Come with me, I'll show you a few more things. So when we come this way, we have, hi Kelly, sending a fax.
Hello.
So when we come this way, here I have this is where we take drug samples. So my students are responsible for putting this away, making sure there's nothing expired. Most of the things that I keep here are things that we use for my patients, where I do primarily endocrine, cardiology, cardiometabolic, renal type care. And this is where the students sit. I'm going to take that camera from you, and then we'll go see my exam room. So when they set up this practice here, they put a table here for myself and the students so that they could be part of the clinic at all times. So on the days that I see patients, so I have patients booked throughout the day. I don't have any openings actually till June. And when we meet on Tuesdays and Thursdays for patient care, the students will present their patients to me. You want to wave and make eye contact and say hi. So we'll present the patients, and then we'll go see them. If I'm not here or we're not seeing patients, what happens is the providers will be here. Here's Kelly again, and she's working with Dr. Hart today.
Hello.
And what will happen with this type of setting is Kelly will go and room the patient from that waiting room that I told you about. Room the patient doesn't ever have to come into this area. So before we go to the exam room, I'll show you a couple more things. This is the kitchen, so sometimes we have lunch meetings, breakfast meetings, whatever we're doing. It's a nice, beautiful space. We have Sam, one of our medical assistants also. So also nice natural light and coloring. We have a conference room that we're able to use. Lots of bathrooms. So this conference room, we have a smart TV here. So sometimes if we're doing online things like ambulatory care practice group on Fridays, we're able to put it up on the screen and we can all do this together. These tables will fold up and roll out. So we've had yoga classes in here and some other things. So I'm gonna stop the video and then we'll come back and I'll bring you over to my room. Okay, so this is my exam room. And what happens is the patient will come in through the door just like I showed you from the outside. The students will go out and get them, they'll bring them in. Then we'll ask the patient to sit down. So one of you be the patient. And what's nice about this is we don't have an actual scale. This chair will weigh them. So it's this device, it lifts them up, it weighs them. We warn them, we're gonna lift you up now for your weight. We get the weight, we put it down. So go ahead and put that down. And then over here with these 4 chairs, that gives the opportunity for my students are sitting. Sometimes I might have a fellow with me if the patient brings somebody with them. And I have these areas. So I sit in one and the student sits in the other. So let's say I have 10 patients for the day. My students will split them up amongst them. They all see all of the patients, but each student is responsible for that one patient. So responsible for working them up, responsible for writing their progress notes, responsible for making sure any prescriptions that I write get to the pharmacy, get filled, that the patient has no problem accessing them, no problem getting them, making sure if there's any follow-up that needs to be done, whether it's getting their labs, whether it's following up on their labs, whether it is checking in on insulin doses and for the week. That student's responsible for that patient for the entire time. Here we keep in these cabinets, I have continuous glucose monitors and other items that we might need in terms of taking care of that patient. Anything to add? All right.
Sounds good.
Thank you. Last but not least, I want to introduce you to the medical director. This is Dr. Hart. He owns the practice. He is the medical director. And when I met him 12 years ago, I said this was a match made in heaven. He knew exactly what it was that I wanted to work on with the students. And I'll let him say hello. And I gave them a tour already.
Okay.
So.
Good. Hi everyone, Frank Hart here. I actually am delighted to be able to speak on behalf of the relationship we've had here at Welllife with the Mass College and Dr. Goldman in particular. We've been together, as she said, for probably about 12 years. It's been a very successful program that's been running during that time. And we just love having the students attend here. They've been engaged primarily with our more severely less well-controlled diabetic patients, but also manage a number of different other modalities as well. So we just love having the team here. They're an integral part of our team, and so we're looking forward to many more years working together.
Fantastic. Thank you.